Victimology, Theories and Applications, Chapter 4, Victim Rights and Services. Case example, 9/11 attacks. 2,753 killed at World Trade Center, 184 killed in the Pentagon attack, 44 killed in the Shanksville crash. Al-Qaeda claimed responsibility. Types of victimization. Primary victimization affects the targeted or personalized victim. Secondary victimization involves impersonal victims such as commercial establishments, churches, schools. More recently has been modified to include those assisting victims such as emergency responders and therapists. Tertiary victimization extends to the community at large. Victim rights legislation. First International Symposium on Victimology in Israel, 1973. UN brought into effect the Declaration of Basic Principles of Justice for Victims of Crime and Abuse of Power, which identified the need for state action in protecting the rights of victims. Canada. Manitoba Justice for Victims of Crime Act 1986. Ontario. Victims' Bill of Rights focused entirely on crime control. April 2004, U.S. enacted Crime Victims' Rights Act. Victims' right to compensation. 1960s internationally, emerging legislation of compensation for victims starting with New Zealand in 1963, Criminal Injuries Compensation Act, then a year later in England. Nationally in U.S., victim compensation is being handled one of four ways. Component of victim witness programs, through victim-offender reconciliation, in conjunction with parole probation supervision, through court-based employment programs. Most states do not allow for restitution for pain and suffering through victim compensation and restitution programs. Nationally, restitution is imposed about 13% of the time. Crime Victims Funds is supported through money collected in criminal fines, forfeited bail bonds, etc. Generally, victims must report crime within 3 days and apply for the funds within 2 years. Canada has a government program for restitution. An award for compensation is not conviction dependent. Victims' rights in the courts. Victim impact statements. Victims have the opportunity to have their voices heard at sentencing. Victim information and notification everyday program allows victims of domestic violence 24-hour access via phone, internet, or email to reliable information about criminal cases and custody status of offenders, available in over 2,100 communities across the U.S. Services for victims. NOVA was established in 1975 as a national umbrella organization dedicated to victim services, new program development, and supporting passage of the new victims' rights legislation. 1988 Office for Victims of Crime established. Funding support is provided by the Office of Victims of Crime to all 50 states to one degree or another. Office of Victim Crimes Resource Center, Information Clearinghouse. The Women's Movement and Services for Rape Victims. The Second Assault, early response by the system to rape victims, traditionally seen by male doctors and generalist nurses. ER environment and needs of victims often at odds, long wait, lack of privacy, etc. Information collected about the victim sometimes would be damning. SANE, SART, past and present. Emerged in the 1970s, SANE programs have grown in number, soon became integral to SART. Domestic violence and intimate partner violence services. Specific services for DV victims emerged in the 1970s. By 1989, 48 states had provisions for funding of DV intervention programs. By end of 20th century, battered women's movement had become well established with approximately 1,250 shelters in operation throughout U.S. and Canada. Latest development within law enforcement are specialized IPV and crisis intervention units. Comprehensive continuum of services for crime victims. Criminal justice assistance. National Coalition Against DV, 1978. National Network to End DV, 1990. Victim Services and Witness Assistant. President's Task Force on Victims of Crime. Victims assistance programs usually located either within local prosecutors' offices, courthouse, or adjacent to the court building. Purpose is to assist witnesses overcome the anxiety and trauma associated with testifying. Some services provided include crisis intervention, 24-hour hotlines, court advocacy, shelter, etc. Psychological response to victimization. Believed to date back to an account of Merlin and King Arthur's court, overwhelming theme in literature from early Anglo-Saxon times to Shakespeare and beyond. Pierre Janet, first study of relationship between trauma and psychiatric symptoms. Different temperaments predispose people to deal with trauma differently. Posttraumatic stress disorder. re-experiencing symptoms, avoidance symptoms, and arousal symptoms. Trauma and the limbic system, seat of the alarm system that protects the individual in the face of danger. Excess hormones can cause immobility, and when trauma is over, the alarm system remains stuck between fight, flight, and numbing. Because systems are links, there is a distinctive type of memory experienced, like a flashback, as if the experience is happening again. Assessment measures and protocols. Clinicians have responsibility of assessing victims' trauma. Ron Asierno has outlined the assessment measures commonly used to measure the mental health impact of violence against women. These protocols are divided into interviews and questionnaires. Interviews. SCID-IV PTSD, used by clinicians and other highly trained interviewers. DISR, specifically for use by the non-professional interviewer. CAPSI, for use by professionals and trained paraprofessionals. Questionnaires. Most frequently employed are the PTSD Symptom Scale, Self-Report, Impact of Event Scales, Trauma Symptom Inventory. Assessment of related symptomology. Beck Depression Inventory, most widely used measure of depression severity. Beck Anxiety Inventory. There are no standardized measurements to assess panic. However, used with panic diaries, can use standardized and descriptive information. Symptom Checklist, SCL-90. Treatment interventions, many which have been specifically designed for victims of crime and violence, range from models intended to deal with the immediate aftermath during the acute crisis phase and those that help manage long-term after effects. Crisis intervention. Stage 1, assessing safety. Stage 2, establishing rapport and communication. Stage 3, identifying the major problems. Stage 4, dealing with feelings and providing support. Stage 5, exploring possible alternatives. Stage 6, formulating an action plan. Stage 7, follow-up measures. Robert's 7-stage model can be viewed as a standalone protocol for initial crisis intervention, but it is imperative that it be functionally viewed as the first step on a continuum of established strategies and supports. Cognitive models for treatment. CBT is a psychotherapy approach based on modification of everyday thoughts and behaviors. Problem identification and problem solving, central components of CBTs. Goal setting and contracting, implementation of interventions, termination, referrals, and evaluation. Additional treatment interventions include psychodynamic, interpersonal, experiential, and body-centered therapies. Therapists employ a range of techniques designed to improve the mental health of their clients. Treatment for child and adolescent victims. Crisis intervention, like brief therapy, eye movement desensitization and reprocessing for children, trauma-focused cognitive behavioral therapy, attachment trauma therapy.